Ooh, good morning, everybody. Happy Tuesday. It's October 19th, and welcome to Impact and Coffee, the last Impact and Coffee of October before we hit into November. We have a very special panel this morning to highlight the work of folks who are doing amazing things within the domestic violence fields. We have really great organizations here today. I'm Robert Nelson. I'm the program manager for Pivotal New Mexico, and unfortunately, my wonderful co-host Michael Green is actually out this week, so it'll be me flying solo, but it's all good. We have all these people on this panel, so we're gonna have a really good conversation today. For those of you who have never been to Impact and Coffee before, we usually do this at the Albuquerque Community Foundation in downtown Albuquerque. However, that thing that happened happened, so we are still in the middle of it, or hopefully getting out of it very soon. So cross fingers. In fact, I heard some relatively good news like about a month ago that new cases are down by 30% since August 1st. I think I said that the last time or like 2 weeks ago, but we'll hopefully see it. And then, I know flu season is coming up, so get your flu shots because that's important. That's so important. And then also the boosters are coming, I think. So I think, that'll be a really good turn of the corner, so to speak. So good to see a lot of familiar faces in the audience today. Thank you so much for joining us. Thank you so much to our Impact and Coffee team. I know Danny and Jermaine are both out there. Thank you so much for holding down the fort and helping make this happen 3 times a month, the first 3 Tuesdays of the month. Impact and Coffee is a welcoming conversation to build community within the nonprofit sector itself. And as I mentioned before, we went to Zoom last year during the pandemic. And we're going to continue going through Zoom for now. I think we're starting to talk a little bit more about what that could look like. But we will get back to you when that happens, so to speak. So if we do go back to in person, we will be the first to let you know that that's happening. And hopefully that'll be soon. So cross fingers and we'll hope for the best. So as far as announcements go, we do have our Next Gen In grant. So if you know anybody under the age of 25 who is looking to build capacity for your nonprofit, we are offering 4 more awards at $2,500 each. You can email us either at nextgenin@syncnm.org, and we can drop that in info in the chat later for folks. But if you have any questions, you're free to ask me over the chat or private message me over the chat or anything like that about the Next Gen In Award. It is sponsored by P&M that helps us, again, build capacity in the nonprofit sector especially. So I think that's it for introductions or anything like that. But also, it is Gratitude Tuesday. I know we practice gratitude every single Tuesday that we're up. And I'm going to ask that folks, as you join our Zoom room this morning, please introduce yourself, your name, your organization, your pronouns, and what you're grateful for today on this wonderful, sunny Gratitude Tuesday. So I'm actually grateful for the nice weather this morning. It's like fall in California, except it's fall in New Mexico, which is even better. And so I will pass to, why don't I pass to Eric first, and then introduce yourself and let us know what you're grateful for today, Eric. And thank you so much for joining us.
Sure. My name is Eric Carter Londine. I am the founder of the newly formed nonprofit Angels Voices Silence No More. It was born out of a desire to help people who are in a situation like myself and my family. My baby brother was murdered by my stepdad 34 years ago, and his killer was never brought to justice. There was a lot of domestic violence and abuse involved in that whole situation. And so I want to help family members that are dealing with domestic violence and fighting for justice, and hopefully help provide a safe space for advocacy, education, as well as outreach into the community. I'm very grateful to be here, but I'm especially grateful for coffee this morning because I just need it. I need a little extra help today. So thank you, and I'll pass it over to Pam.
Thank you, Eric. That sounds like a fabulous nonprofit. Thanks for doing that. I'm Pam Weissman, and I'm the director of the New Mexico Coalition Against Domestic Violence, known as NMCADV for short. And we are a group of, I can never remember, between 30 and 32 on any given day, domestic violence providers from all around New Mexico. They provide services for survivors and their children, and also to those who are charged with or convicted of domestic violence. So that's me. Thank you. And I'm going to pass it over to Angel.
Thanks, Pam. Hi, everyone. Good morning. Gwadzi Hopa. My name is Angel Charlie. I serve as the Executive Director of the Coalition to Stop Violence Against Native Women. I come from the Pueblo of Laguna, and it's an honor to be here with all of you today. Eric, thanks for sharing that with us about your family's experience. The Coalition is a survivor-led, member-led organization working throughout the state of New Mexico, particularly with the tribal communities. We serve 24 right now. We say regionally based because there are some tribes that we work with that aren't in the state of New Mexico, like Isleta del Sur in El Paso and Mountain Ute in southern Colorado, and then the Navajo Nation, which expands into Arizona and Utah. But we really work on 4 main areas. Policy advocacy looks a little bit different on the tribal, state, and federal levels. We do community building, and that looks different. We have actually a run coming up this weekend. I keep saying at the end of the month, and we're at the end of the month. We do training and education. So us, along with Pam's organization, are the 2 domestic violence organizations that certify victim advocates to go out and work in the community. And then we always forget the last one, no matter how I've got them teed up, technical assistance. And so, that's always looked different in every single community or organization that we've worked with, but it's an honor to be here with all of you. Jade, I'll pass it over to you.
Thank you. I'm Jade. I'm with the New Mexico Coalition of Sexual Assault Programs, she, her pronouns. I'm the communications and systems specialist over there. So I do all things like background stuff for trainings, social media, newsletters, stuff like that. At the coalition, we are working to end sexual violence in New Mexico. We do this in several different ways. We collect data on domestic violence and sexual assault in the state and produce a report on that and our findings. We provide training to professionals like law enforcement, prosecutors, medical professionals, and mental health professionals. And we also provide technical assistance. We work with 11 different SANE programs throughout the state. So these are the sexual assault nurse examiners who conduct sexual assault exams and domestic violence exams. We work with 13 sexual assault service providers. So these you might know as rape crisis centers. They provide counseling, education, prevention, and also 11 children's advocacy centers. So this is where kids can go who are experiencing abuse or sexual violence. They conduct forensic interviews and provide counseling and support for families.
Thanks all. I really appreciate it. And welcome to Impact and Coffee this morning. I know we sent out questions beforehand, but I just wanted to ask this first question to just jump right in. We know the story of last year. We all went through it. What is the story of this year? How have our and your communities been impacted by the ongoing pandemic, coming in, coming out of it, and going back to in-person and hybrid? What has been the story of your year now that we're here in October, entering into almost like 2 years of this? So, and Angel, I'll jump to you first.
Thanks, Robert. So I was here, I think a year and a half ago, talking about those immediate impacts of COVID-19. And while the state and the country feel like they're moving forward and opening up and having some normalcy in our lives again, it's important for us to remember that tribal communities are still closed in a lot of ways. We are just being introduced back into community this month. We're doing our first tribal visit in 2 years. So I think that's important to remember and to just think about when thinking about those long-term impacts. We also know that tribal communities kind of in the aftermath or that are still going through this were disproportionately affected. We're reading initial reports right now that that guardians, grandparents of tribal or indigenous folks were lost at higher rates than their white counterparts, right? And so family units have been completely disrupted. I heard a story a couple of months ago in a meeting I was in about a a gentleman who works with a tribe in Alabama. He's from the tribe in Alabama. And during COVID-19, they lost 30% of their language speakers. And so, the long-term effects, we don't know. We're still going through it and coming out of the other side. And I think, we'll know in years from now what the impact really was. I'll hand it over to you, Pam.
Yes, thanks, Angel. So, wow, 2 years. That's really unbelievable. Someone said to me, or maybe, no, I think I actually heard this on TV and I repeated it. I said, this was, a year and a half ago. Someone just said we could be in this for 2 years. And people were aghast, right? It's like, that can't possibly happen. And here, I guess it's a testament to our resilience that we've got a lot of that, don't we? That we're still here. Our domestic violence programs sort of, and it's the case I know with Angel's programs as well, it happened so quickly. We had no playbook. No one knew what to do. Should we close our shelters? Do we need to start using hotels? Do people have to get tested? What happens if somebody tests positive? How do we keep them safe? I mean, it was every day we were with our programs trying to figure out what was the best course of action. And sometimes I think we were probably right, and sometimes maybe we weren't. But what happened as a result was that we really got engaged with others and with our programs in a way we never had before. I see Angel shaking your head, right? Because we were meeting 2-3 times a week. Before, we would, all get in our cars and drive for 4 hours someplace and, do a meeting and then come back. But now, because, still now, but then that wasn't happening. And so we could make use of this platform. And so there was a lot of connection that would never have happened otherwise. And so that's I don't think there was really any good news, but that was an adaptation that I think will last. We all got to know each other better, and we realized that we could do things like this on Zoom, and that it was better and easier for people because we're such a big state and people don't have the money to travel all over. And we did a lot of that. And we spent a lot of time alone in our cars. And I think we're finding out that it can be a lot better spent. So that's, the other thing I just want to mention is that our programs did a really unbelievable job, I think, of making sure that people were safe. We heard from around the country that domestic violence programs were the word that I heard was ravaged. And that really didn't happen here. So our programs took the steps they needed to take to I think, keep themselves safe. So that we're really appreciative of that. So thank you. Jade?
Yeah, thank you. With the pandemic, we definitely saw an increase in need and an increase in the severity of the violence that people were experiencing. So the people who were coming in for our services had experienced a lot of violence. And it also really pointed out the areas that we were lacking. We knew there were areas of need, but it really exacerbated that problem. For instance, the wait lists for things like counseling grew really lengthy, and we already have a huge issue with that. There are some parts of the state where survivors have to wait up to 12 months to receive counseling after a sexual assault. And the pandemic only made that more intense and longer. In terms of kind of a good and bad thing that came out of it, we switched to a model of telehealth a little sooner than we had anticipated. We were hoping to kind of move in that direction, but the pandemic definitely forced us to kind of get on that path a little sooner. But in some ways, that's great. It allows us to access survivors where they are, especially in places where it's harder for them to go and get services. But with things like the internet, it also showed us areas of need. A lot of places, especially in rural New Mexico, on reservations, don't have that access to the internet. So they were kind of at a loss for accessing their services during the pandemic. But hopefully moving forward, this can kind of teach us a model of having both online options for help, and also the in-person ones. And I'll pass to Eric.
Probably don't have a lot to add to this because I'm still in the startup phase of the nonprofit. But I think it is important to note that a lot of the struggles that we see in the community in New Mexico and in the communities in New Mexico with domestic violence and with abuse, it was really terrifying, I think, for a lot of people, knowing that kids were being sent back home to be in these situations and all of those things. And I think we're gonna, like Angel said, and we're gonna see lasting impacts of this pandemic for a long time. And I don't think we've even started to uncover some of the things that have happened. But I'm looking forward is not the right way to say that, but I'm anxious to get this off the ground and start helping people.
I just want to dig a little bit deeper. I'm hearing some themes here around some of the things that are happening from last year, and then and then this year, obviously. But is there one big lesson you learned from last year? And Pam, you said we were stuck alone in our cars last year, and I still know how that feels working from home. But is there one lesson that you've taken from last year and applied to this year and applied to beyond? And Eric, I'll start with you this time. I know you're still in startup mode, but you're learning all the time.
Oh, wow. Well, I think one lesson that I learned is really something that probably a lot of people learned, which is, I took a lot of things for granted personally, in terms of, being able to connect with people face to face. And I think that that's something that a lot of people crave and need, and it's really important. So it's also very difficult to start a nonprofit in the middle of a pandemic. I learned that as well. It's taken a lot longer than I thought it was going to get it off the ground. But I think those are the two big lessons for me.
Hi, this is Jermaine. I have a quick question. I worked with Solace for 2.5 years. And so I recognized in pre-pandemic mode how challenging it was to establish trust. And I'm just wondering, with the pandemic, has that been an even bigger challenge when it comes to letting men, women, and children know that there's help available since the pandemic?
I think one of the things we learned, Jermaine, is that calls for help increased. And what that tells me, kind of addressing your question, is that people were wanting assistance and service, that they needed help and they were reaching out for it. Off the top of my head, I don't know what those call increases were, but we do know folks were reaching out and asking for help and assistance in ways that they had never done before.
I think I could also add to that I think we didn't realize exactly how much of a barrier it was for people to have like locations, to have a shelter or counseling offices or whatever, that people didn't feel safe or comfortable, or that sometimes they just weren't even able to get there. And I don't know how many people we're talking about, but I think many. And so the lesson learned was that that having our services really be accessible is really so important. And I think we probably thought they were, but I think it really showed us that we need to do a lot more to make sure everybody who wants help is able to get it in the way that's best for them.
Yeah, just kind of going off your point of accessibility, that definitely showed us that too. And what you're saying with the increase in people seeking out services, and really kind of showing us where we were lacking very glaringly. And kind of that location, right? There's so much unequal access depending on where you live. People in certain parts of the state, there are, I think 27 out of our 33 counties don't have adequate services for sexual assault survivors. So there are just places that if you live in those areas, you don't have easy access to a SANE exam. You don't have easy access to a provider or counseling or things like that. And so really just making that very, very clear that, location is so important.
Jade, can I just ask, what was that quote? How many counties?
27 out of 33 of our counties.
Wow. Don't have adequate services?
Yeah.
Wow.
Yeah. So we have, I don't know the exact number that don't have all three of our SASP, SANES, and CACs, but I think it's over like 10 counties don't have that.
If I could just jump back in and answer that question, like what was the lesson? I think for us, it was that domestic violence or gender-based violence doesn't just happen in its own little world. Sexual violence doesn't happen in its own little bubble, if you will, that we saw and learned, and like everybody could see that there were so many social issues that impact in gender-based violence, sexual violence, right? Jade spoke to the broadband access. That's a DV and sexual violence barrier, right? When tribes or rural communities don't have that. Food insecurity. So many of our programs were putting flyers inside of grocery bags to we had to figure out another way to reach people who couldn't come out of their homes. We were on lockdown orders. So food security was a big barrier and intersection to our issues. Equal pay, benefits, healthcare, like all of these things are gender-based violence issues. And I think that was the biggest lesson for everyone, at least with our organization, that we need to be taking on more of these social issues and not just the training and education aspects of what we do.
May I add something also? Well, we're going to make it so that you can't get through your questions, though, right? That's fine. What I was thinking too is that, in terms of a lesson, is that I think we've always known this, but survivors know what's best for themselves and for their families. And during the pandemic, people couldn't necessarily just leave, because where would they go? And they had to weigh the risks of going into a shelter or into a hotel against staying. And so I think survivors did what they've always done, is to find ways to keep their families safe. And it was really magnified during the pandemic, but that's what they did. And I think we need to remember that, because we're so prone to saying, you must leave. Well, in this case, that was not good advice, because people couldn't leave. And so they needed a different kind of help from us. And it forced us to get better, but not as good as I think we can be and will be, better at providing that level of help and advocacy to people who, for whatever reason, are not going to leave, either because it's too dangerous, or, as Angel said, they don't have any resources, there's nothing for them to do. It helps us to think about a whole range of possibilities for people, and not just you leave and then we get your order protection and then you go get a different job and then you get childcare. We have, our programs have always known this, but it just made it really clear, I think, everywhere, that there's a lot more to it than that. And being responsive to the actual needs of people, sort of, like Angel said, food insecurity, what people need, we need to know what that is and be able to respond.
Tiffany Hiron mentioned in the chat that self-care was very important, more than ever during the past 2 years.
Mm-hmm.
I agree with that wholeheartedly. And so I did want to ask, like, just, and if you want, if you're free to answer this question or not, but like, how are you doing, like, through this whole thing? Because it's one of, like, we don't ask that question a lot here at Impact and Coffee, but I think when we center our feelings, I think like we are also dismantling the things that were oppressing us before the pandemic, the things that continue to oppress us like throughout the pandemic. So I just wanted to take some time and center what that is for y'all, and how are you working and taking care of yourselves?
Oh, that's a question. This last couple of years have been very difficult personally. Through my advocacy work, I also created a podcast to help elevate the voices of victims' families in New Mexico, and that's been taxing, because there's all these other things going on. My father passed away from COVID this last year. So I think mental health and self-care, somebody had mentioned self-care in the chat, it is critical, especially for people who are in this type of work where you're surrounded by so much trauma constantly. It's critical to take care of yourself. And so I've had to take extra steps. I've had to up my therapy sessions and do all the things I need to do to take care of myself. So I think it's important for me to remember not to neglect my own mental health and my own self-care, because I can't help people if I'm depleted. So
appreciate that, Eric.
I was supposed to pass it to somebody, but leave it open.
Silence is okay too.
I think, this field is very much a field where when in our work, everything kind of feels like a crisis. So for that to also, bleed into our everyday lives and our lives outside of that definitely, affected me, affected all of our caring professionals, is to kind of feel that constant sense of emergency and, kind of that life or death need to get things done, just kind of constantly. And I know that affected a lot of people, all of our counselors, our SANE nurses, things like that. And I think kind of going back to one of the big lessons, just being able to see the resiliency in people and our programs, and how they adapted and were flexible and were kind of open to communication with each other. And that, in that moment of emergency and panic, there was community and people coming together and sharing resources and focusing on that bigger picture, just kind of reaching out and making sure that, your coworker is okay, in addition to the people that you're working with.
Yeah, it also makes me think that I think most people who don't work in the field of domestic violence wouldn't really necessarily know what it must be like for people to constantly feel unsafe. Like there's a threat out there, not really sure when it might arrive or if it will, but that constant low level with bursts of high level fear and anxiety is really distressing, obviously, for people who are in domestic violence situations, including children, right? Who are affected, as Eric said, for their entire lives because of that. But I think now people who never would have occasion to think of that now have an inkling of what that must be like, right? To be afraid, to have this anxiety, to not know whether you're safe. And my hope is that recognition increases everybody's empathy and understanding for people who have gone through domestic violence, that boy, there really is a toll. We had no idea. And that will support communities getting more involved and wanting to understand and to help.
Thanks for saying all of that, Pam. I think the only things that I would add for like how are we doing I don't know when it happened, but there came a moment, it feels like in the last 3 to 4 months, where it felt like we were out of that urgency. Like our organization was literally driving PPE out to communities and meeting them at the borders, and just dropping off like medical equipment. And then it just slowly like stopped, and we were like, well, oh my, we're not in urgent response mode right now. What do we do? What do we do with ourselves? It's been like we were automatically remote working. We were all in response mode. I think in so many ways, nonprofits across any social issue filled in the gaps of government in so many ways over the last 2 years that nonprofits were working harder and more than ever before. And so for our team, what we did was get intentional about a couple of things. One was celebrating, which was something we hadn't, done. A celebration is usually done with each other or in proximity to like one another. But really just celebrating our little moments of success. Like, look, we distributed 5,000 masks last year. That was huge. We also took time to reflect and really have a conversation with ourselves. So we said, if we could have told ourselves something last year before all of this went down, what would it have been? Now that we've learned some lessons about how to care for ourselves or where we didn't care for ourselves. And some of the things, that I'll share mine, which was, I wish I would have drawn more strength from the people I do this for. Because there were times where it was so exhausting. I was crying. My skin was so dry. I was like, my hair was falling out. And I thought, why am I not spending time with the people I love and that give me strength and, safety? We couldn't in the very beginning. And then that became a habit of not spending time once we safely could. So that was one of the things. And then rest. Rest needs to be a part of the work. And so we implemented as an organization 4-day work weeks, with our Friday being personal and professional capacity days, so that staff can start and begin like their weekend and get 2 full days of rest. We expanded our leave policies and got a little bit more flexible with that. We've introduced a couple of different ways of staff support, like stipends, offsetting some of the cost that our staff incurred over, all of our internet costs went up, all of our food costs went up from working from home, our electricity and our utility costs as individuals went up. So how, as organizations, are we supporting the people who work for us? Those were some of the ways that we sought to care for ourselves this past year.
Did I just hear, Angel, that you have 4-day work weeks?
Yeah, and it's hard to take them. It really is, but it's important, and it's becoming a habit, but it's definitely not fully implemented at this point. We're still having to go back and learn, what we give up in order to have this. But right now, Fridays serve as professional or personal capacity building is what we call them.
Nice. You are the second organization I've known that actually has worked to implement that. And I appreciate you sharing the struggle with it too, because that's also real. And I appreciate just this panel, like all of you sharing, some things that are vulnerable with you, with your own lives. And I think that's important to do that as we are as we are continuing to deal with the situation out there around the world and with the people that we love and the people that we work with in community. We've done a lot of reflecting in the last year, from the last year, but I want to just look forward a little bit. So what is something you're looking forward to, whether it's in the next few months, the holidays are coming up, or are you looking forward to 2022 and what's in store for you all with your organization and your teams there and your communities there? And if anyone wants to jump in first, you are welcome to do so.
I can just jump in. Oops. Is Angel disappeared?
Go for it, Pam.
Okay. All right. this is one of the things that we, so over the last 2 years, obviously, most of what we did was kind of internal. We were trying to build the capacity of our programs, increase their resilience, all this kind of stuff that we all were doing. And so now I think we're going to start to have more of an outward focus, and we're looking at the system in a way that we really hadn't had time to do. So, we have to work on two different levels. We have to work on the level of helping people become safe and increasing their well-being and their sense of hope. And we do that. And we also have to work to change the conditions that lead to the problem of domestic violence to begin with. And so we know that during the pandemic, for example, the rate of domestic violence convictions, according to the University of New Mexico, went down to 8%. And the level and the number of dismissals, the percentage of dismissals cases, right, where nothing ever happens, hovered at around 80%. And we are not at all for, saying that people should go to jail, but what we are for is helping communities, including systems, prosecution, and law enforcement, to provide a consequence for domestic violence. Without any consequence, we know that it will worsen. And the consequence could be something like being referred to a battering intervention program, or it could be something as simple as getting the message, a clear message from the system and from the community that domestic violence is not okay here, because research is really clear about that. When that message is delivered and received, violence does go down. So that's really that's quite a shift, I think, from trying to just for all of us just to make it and to survive, to really having an eye towards the conditions that we know need to change in order for violence to be reduced.
Pam, this is Mary. Let me ask a question on your comment.
Sure.
Do you think the percentage of dismissals went up because of perhaps no-shows on the part of the accuser, actually the victim, and a lot of that due to fear of not having a place to go, in particular in this time of COVID?
I think there are lots of reasons. That's a really good point. And some of that was going on well before the pandemic. So I think our conviction rate had been something like 15%, and it went down to 8%. So it was never very good to begin with. But I'm sure that there was a strong element of that. People didn't feel safe. I mean, they've never felt particularly safe, but they certainly didn't going into court. And sometimes the courts weren't really functioning in the same way that they once had. So I'm sure there are lots of factors, but so I guess I would be hesitant to say that was the reason, since it's been going on for some time, but I'm sure that didn't make matters better. Survivors just not having the opportunity to safely get some kind of redress or help. I'm sure the pandemic did not improve that situation.
Thank you.
Yeah. I also noticed Teresa, we call her Terry, sorry, Terry Garcia from the coalition also mentions conference calls, for court issues, translation issues, all of that did become problematic, as you were saying.
Can I ask a question? I know the other three panelists are still going to answer, but before I forget, I'm glad that you talked about this, Pam, because my best friend is a public defender. He's on the East Coast. And we often have these discussions about obviously not being a fan of our jail system, but also knowing we need to address so many problems. And so my thing to him is always like, you should, and I'll help you. You should make a thing that gives these offenders the resources that they need. And then, but also knowing that there aren't always resources for these offenders. Like genuinely, what can those people in those situations do? You know, he's got like 240 clients. He's constantly overwhelmed. There, you know, the prosecution is rarely interested in, like, there's oftentimes that victims don't show up. And I think it's just dissatisfying for people on every across the spectrum. Yeah. And so I guess my question is here, at least here in New Mexico, what have you seen as the most effective offender kind of programs to address change? I mean, I think we haven't really talked about the root causes, which I would love to talk about, but we know that so many causes of problems in our society is basic needs not being met and poverty and so many things, racism, so many things.
Yeah.
So once people are at this point of now we're talking jail time, now we're talking about it, like, are there effective programs out there that you've seen, even if it's across the country, that sort of address issues with the offenders?
Yeah, thank you. So New Mexico is thought to be a little unusual in a good way when it comes to what we call battering intervention programs. The state actually funds them, which is not typical. And so that means that there are a number of programs. I think the majority of our domestic violence survivor services also have programs for offenders. And by statute, those are 52 weeks in length. And whether that's enough or whether it could be more, I mean, we're always kind of discussing that, but we have a really solid infrastructure of some people call it offender treatment, battering intervention. And this year we're asking for more money also to make sure that those programs can continue. Not just because the people who commit crimes are helped, but communities seem to be more engaged and do better in places where those programs exist, because battering intervention staff, where they can afford it, can be out talking about accountability and how it can be done, without jail. But really, and we also know that those programs can certainly be effective, but they're only as effective as the systems that surround them. So if there's no accountability and there are no reasons really to consider something different, then often people, being as they are, just won't do that. So what's required, I think, for change minimally, doesn't guarantee it, is that there is some consequence. And the consequence can be a community saying, oh no, you cannot do this, right? Doesn't mean we put you in jail, but it means as a community, as a system, we all say, not okay. And the alternative to that is to have no consequence, which makes it worse. So consequences, and then a program like a battering intervention program that can help people reflect on what they did and what effect it had. That won't be meaningful for everyone, but for a number of people, I think it will be. And then helping people who are in those programs to see that changing is a choice. It's a choice. It's not, oh, I was out of control, or I was drunk, or I was really mad. Lots of people get drunk. Lots of people get really mad. Doesn't mean that they are abusive, right? So those things might be correlated, but they aren't causal. I think we probably all know that. But consequences, reflection, and seeing that change is a choice, along with a system that holds people accountable and says, you can't do that. And you have to go to this program and you have to attend the 52 weeks, right? So that it's taken seriously. I think all of that is, will it be the total answer? I don't know, but it will be better if we can realize that sort of an approach. I hope that answered your question. I don't know.
Yeah, I was kind of wondering, do we have a good program in New Mexico, and is it available to most people? And sounds like that 52-week thing, which is unusual intervention.
Yeah. We have a number of programs. I think like our domestic violence survivor services, I think 18, 19, 20 of them maybe have those programs. Children, Youth, and Families Department sort of approves them, says to the courts, yes, you're okay. They also administer the funds. And then there are some other that are sort of maybe mental health programs that also have. So there are a number of programs. We have excellent really kind of state-of-the-art training and supervision for the people working in those programs. So our belief certainly is that they're effective, but again, they're only as effective as the systems in which they're located. It takes everyone.
Yeah, and including the community, right? Like,
yeah.
I mean, like I remember having a conversation with my best friend when I felt like she was getting, or one of my closest friends, when I felt like she was getting violent with her son.
Yeah.
And it really takes it. I don't know that I see that many people standing up to their friends, like whether it's in the political world, certainly not. And also amongst our communities, you know.
Right. Absolutely. Yes.
I was wondering if that's one of your guys' things that you wish were different. I mean, I know there's many things you wish, but what your wish list would be in that way. Anyway, thank you.
Yes, of course. I also want to mention that Terry Garcia said we also provide trainings that are open to the public to attend to learn about battering intervention. So most people know very little about that, right? So.
And I would just like add that if we could tear it all down, we would tear all of the system down and rebuild it back up, it would be around offender accountability, or the folks who are causing harm accountability, right? I think we talk about this in the Murdered and Missing Indigenous Women movement, that the ones being impacted the most, the Indigenous women, are charged with having to solve the problem. And in a lot of ways, it's reflective in our movement here. Survivors are charged with having to solve this issue in their families. So it's a great question, Trish. And we're in a moment of build back better. Like, what now are we going to do? Because it feels like we have a moment of pause. It feels like there is a unique ability right now to change some things. And we've gotten a couple of calls from tribal community who are ready to start building their own shelter, and the ways in which it can look from all of the lessons that we've learned, not only during the pandemic, but from, years and years of movement work. Perhaps we can build back better. And then just to answer the question about like what does looking forward look like for the Coalition to Stop Violence Against Native Women, we're throwing out our strategic plan right now. We're going back in the month of December and reconfiguring our direction, because so many things have changed and nothing in that document makes sense for us as an organization. But we'll continue to work on those big system issues as they come, like around where we introduced last year with a couple of organizations, and we'll do it again this year in legislation, the state Indian Child Welfare Act. It's the codification of the federal law into New Mexico state code. We worked with youth last year around the Black Lives Matter movement, really centering Black and Indigenous solidarity so that our communities are not divided, but can come together around these issues of violence. We've recommitted and are committing ourselves to food sovereignty work. So we've provided garden boxes for communities across the state, and will continue to assert that food insecurity is violence in our tribal communities and all communities. When our folks have access to wellness, then we will do better. We will be better.
Yeah, thank you both for kind of bringing up that idea of the conditions surrounding sexual violence and domestic violence. Kind of the lesson about, communication and resource sharing with other groups, that definitely extends not just to, us working with our programs, but to us working with groups that are working on anti-racist work, groups that are fighting homophobia and transphobia, and recognizing that, when we see bills that are trying to prohibit trans youth from participating in sports, that's an issue we need to work on. When we look at, mass incarceration of people of color, that's also an issue we need to work on. And also education, and that, education is prevention. And that if we teach our communities and we provide these resources, we can stop violence before it happens. And kind of, again, looking forward, some of the things that we're working on, we are trying to get a bill passed to require affirmative consent being taught in schools. So all high schoolers have to take a required health class. And we want them to learn in that class what consent is, what it looks like, that yes means yes. So I'll drop a link to the petition that we have for that in the chat. But that's definitely one of the projects we're working on to try and, get the movement to end sexual violence and domestic violence to not be reactive, but to be proactive and to kind of center education and healing.
And I think I'm looking forward to getting this nonprofit off the ground. Some of the plans that I have in place, aside from forming a board and doing all the things that I have to do to get it going, is really starting to work together with other partners in this space and provide resources and maybe fill in some gaps that are missing here locally in New Mexico. We also want to start a research portion to look into some of those root causes and see how we can make an impact from this perspective. So I'm still very early on in this, but I'm looking forward to getting it off the ground and really starting to work and hopefully make an impact in these communities.
Thanks, y'all. I really appreciate that the audiences, that folks have from the audience have unmuted and asked questions. We have like 9 minutes left, but I would just open up and invite folks if one person or an audience member has a question, this is the time and space to do it before we ask our last question today.
Can I ask a question?
Sure.
Or make a comment? Actually, it's make a comment. So we have a ton of ARPA money in the state, and the governor is sitting on approximately, I think it's 1.1 billion, waiting to see what's in the infrastructure bill and the reconciliation bill before committing. The state has the biggest revenue surplus in its history.
Yep.
And they are also taking a wait and see attitude. So my suggestion is for somebody to do the hard work of reading through the reconciliation bill, but from everything I've heard, I don't think there are any provisions in there for services for domestic violence. And so I would make a pitch both to the governor and to House and Senate leadership that some of those revenues should go toward domestic violence services, particularly if you have 27 counties without any service or shelter. So that's my comment.
Thanks, Sephora. Appreciate that.
Yeah, thank you for that. We definitely, in addition to our affirmative consent campaign, we are asking the governor for increased funding because our sexual violence programs have, quite frankly, never really had the funding that they need to support the need in New Mexico. So that's the other petition if you want to sign that. If you feel really passionately about it, you can contact me and we can work with you to maybe write a letter to the editor or something like that. But we definitely, our programs need support. Our SANE nurses, there are some places in the state where survivors have to drive 3 hours to get a SANE exam after an assault. Some of these nurses are paying out of pocket to go and travel and meet these survivors where they are. So funding is definitely a big issue for us. And moving forward, we would love community support to kind of raise your voices around that, definitely, because there is need. There is a lot of need.
Can you guys make sure to put your social media handles either in the chat or just say them in this last part so that we can help elevate your message if we see it in our own social media?
Yes. I'll ask this last question. So what we always end with this question. What can our community do for y'all today?
I guess just to maybe add a little bit to what Sephora said, we too have made a request of the governor personally for additional funding. That the pandemic really exposed the cracks, I guess, in our infrastructure. So we have also done that. And support would be welcome. But also, I just want to thank the people who were on this call and who are listening to it or will listen to it for being engaged. Domestic Violence Awareness Month, right? Sometimes I think we forget just how important it actually can be, that we really do need our communities to have the knowledge to act in ways that are really helpful and responsible. So just having this conversation, just having a dialogue is really a big step forward. And so I just want to say thank you for offering this, and we would be happy to come and speak anytime, any place, pretty much, right? I actually wrote a talk for this today because I didn't read my email to find out that I didn't have to do that. So I have one. So if you need a 25-minute speaker, we'd be happy to do that. So this is certainly the month for it, but any month is a good month to talk about domestic violence. So thank you all. It was great to be here.
Jade, I'll call on you next, and then I'll go to Eric and then Angel.
Yeah, so I mean, supporting kind of the initiatives we have going now would be awesome. Signing those petitions, sharing on your social medias if that's something you would like to do. But kind of to echo what you're saying, just to have those conversations, especially with sexual violence, that's still a very taboo topic. It's a hard conversation to have, but just in your own communities, that start small and kind of, the people around you, show that you support them, and that you're a safe person to talk to, and that, you're comfortable with shutting down jokes that are kind of inappropriate, calling out victim blaming, things like that. And really just being a voice in your community who's not afraid to have these conversations and not afraid to talk about it.
Yeah, I think I can echo what Jade and Pam both said. I think it's important to start at home and start in your circles and really work through that. But also, I think that to Jade's point, a lot of these issues are somewhat taboo in our society, and the more vulnerable and open and honest we are and willing we are to face these things, the better our chances are of making an impact and making a difference in these issues. And so, I salute all of these strong, amazing women here who are fighting for that and are also providing that safe space. Be on the lookout for Angels Voices Silence No More, and when things start coming up, would love the support of the community here to get off the ground. And like Pam, I'm always available to have these conversations as well.
Yeah, VAWA is making its way through the Senate right now. We should all be calling our legislators. It hasn't been reauthorized for way too long, and there are we want to see the full tribal provisions make its way through VAWA. So that's one way that folks can support. When the State Indian Child Welfare Act gets reintroduced in the New Mexico legislature, calling your representatives and ensuring that this one makes it through committee. It got stalled in committee last time, and that's unacceptable. Indigenous children deserve to be in their communities and stay in their communities. I think also following us on social media. I know our handles were in there, but we do a lot of calls to action in there, just sharing an article or letting folks know, in silent kind of ways that you are a supporter, and sharing that information is important. For our organization, you can become an individual member or an organizational member and really get involved with the work that we do as the Coalition to Stop Violence Against Native Women. Signing up for our listserv on our website is another great way to get involved with us. All of our workshops and trainings are free. A lot of them are open to the public. We have one tomorrow about land violence and its intersection against violence against women, particularly sexual violence. We know when extractive industries are present, that those rates do increase. Here in New Mexico too, man camps look different. There are hotels and motels that are completely rented out by oil field workers. And then I think the last for, in our professional work, to center Indigenous voices, if you're having a conversation that impacts community, ensuring that somebody is there from those communities and is informed and, has a voice at that table, that I think are some ways.
Yeah, absolutely.
Thanks, all of you. Big virtual round of applause for all of our panelists today. Thank you so much for joining us. We loved every bit of this conversation and all throughout. And so that's it for Impacting Coffee for October. Our next one is on November 2nd at 9 a.m. So come back and join us over Zoom and bring your coffee. And we'll have some really great speakers planned out for November 2nd yet. I can't promote that just at the moment, but we will get it. If you are on our email list, we will add, and if you're not, we'll add you. But we'll be making those announcements here very soon for our November programming. Big shout out to all of our Impact and Coffee team, Abby, Michael, Danny, and Jermaine, and Denise. They make this happen every month, and I really appreciate all of their hard work in doing this. Big thanks to all of you, all of our regulars who come out almost every Tuesday. We really appreciate y'all, and big huge thank you again to our panelists today. We really appreciate not only just you are holding up a lot of spaces and a lot of things in our communities, but your organizations too, holding it up for our community. So that's it. Again, thank you so much, everybody. Have a really great rest of your Tuesday and the rest of your week, and may all your lights be green. We'll see you soon, y'all.